What causes gestational diabetes? Gestational diabetes develops when a woman's body doesn't make enough insulin to deal with the carbohydrates in her diet, especially simple sugars found in many foods. Women who have gestational diabetes often experience a raised blood glucose level that may cause serious damage to the baby if it becomes excessively elevated. Gestation diabetes is one of the main causes of type 2 diabetes in adults. If you are experiencing gestational diabetes symptoms, you should talk to your doctor about what it is and how it can affect your pregnancy. Gestational diabetes, or diabetes which occurs at conception and resolved at birth, happens in about 9.2% of pregnancies in the United States alone. Gestational diabetes mellitus is generally defined as impaired insulin tolerance with onset or earliest manifestation during pregnancy. It may also be called insulin resistance, non-insulin dependent diabetes of pregnancy, or just diabetes. In any event, the condition is a result of impaired glucose regulation brought on by low blood sugar or folic acid levels in the mother's circulation, liver, or brain. While some women develop gestational diabetes after having a baby, others get the disease before they give birth. The most common way to diagnose gestational diabetes mellitus is with an oral glucose tolerance test, OGTT. This test measures your blood glucose levels 3 times a day, and the level should be within the healthy range. You will also have a urine testing strip to check for acidosis. Your doctor might also want you to perform a couple of fasting tests to make sure that your blood sugar levels are within the normal limits. These fasting tests typically involve very low amounts of carbohydrates, such as drinking only water and eating only egg whites, oil, or milk. In gestational diabetes occurring during the second trimester, usually called insulin resistance, there is not enough of the hormone insulin to go to all of the cells of your body. Instead, some glucose gets stored in your fat cells. Excess insulin production has been linked with type 2 diabetes. If this is your case, then you will probably develop polydipsia or polyphagia, which are 2 other types of diabetes. Many factors are thought to increase the risk of developing gestational diabetes. These include being overweight, having long periods of cigarette smoking, having a family history of diabetes, living in a poor neighborhood, being diabetic in your youth, not getting regular exercise, and living in a very high urbanized area. These factors are known to impair the functions of the pancreas, insulin delivery to your cells, and the production of glycogen, the starch that is made from glucose. Genetics and environmental factors are thought to combine to cause gestational diabetes. Women who suffer from gestational diabetes may experience a wide range of symptoms. These can include frequent urination, thirst and hunger, depression, fatigue, heart palpitations, frequent urination, dark circles under the eyes, and high blood pressure. Excess sugar is deposited in fatty areas of the body, causing an imbalance of electrolytes, sodium, potassium, and chloride. This, in turn, can cause complications such as osteoporosis, nerve damage, kidney damage, eye damage, and heart problems.